What is passive range of motion? Passive range of motion is movement of a joint that is performed completely by the therapist. Information from this type of movement is used to determine the anatomical range of motion available and the end feel at the end of the joint's natural range of motion. So what are we noting during passive range of motion? The amount of range of motion, either normal, hypomobile, or hypermobile, the quality of movement, when and where discomfort or pain occurs, if there are any changes in intensity and the quality of symptoms, and if there are any patterns of limitation. End feel can be classified as either normal or abnormal. Some normal types of end feel are bone to bone, which is hard, painless, or unyielding. For example, elbow extension. Soft tissue approximation. This is where compression of soft tissue stops the movement. There's a mushy feeling. For example, elbow flexion. Tissue stretch is hard or firm with some give. Some divide this as soft or elastic or hard or capsular. For example, shoulder lateral rotation. Some abnormal types of end feel are capsular, which is a hard tissue stretch. This occurs earlier in the movement and feels more abrupt and thicker. A muscle spasm end feel, which is a sudden and painful resistance to movement. When it occurs early in the range of motion, it's usually related to an acute injury. When it occurs later in the range of motion, it is often related to joint irritability or instability. Spring block end feel. This feels like an early tissue stretch, often caused by compression of damaged meniscus, for example, in the knee. And an empty end feel, where the movement cannot be completed due to pain.